Hi, everyone. My name is Dr. Narjust Duma. I'm a thoracic oncologist at the University of Wisconsin. I specialize in women with lung cancer, where we have a dedicated clinic for women with lung cancer. I'm here to share my journey of training in the United States. I'm originally from Venezuela. So I was born and grew up in Venezuela. At the beginning of the 2000s, Venezuela started having some civil unrest, in part due to the dictatorship that still taking place. So we moved from Venezuela to the Dominican Republic for medical school, where I have family. So I went to medical school at La Universidad Catolica Nordestana, which is located in the northeast part of the country. My training was primarily in Spanish. I had the opportunity to work at the border between the Dominican Republic and Haiti, and that started to spark an interest in social justice and cancer health inequalities. This area of the Dominican Republic is significantly underserved. While at medical school at the last year, I traveled to the United States to learn English and start studying for my steps. So I went back to the Dominican Republic after several months in the United States and started studying for my STEP 1. At the same time, I was doing a mandatory government rural rotation. So this is a rotation that the government in the Dominican Republic requests of all medical grads to complete in underserved areas of the country. This can be in small towns or hospitals that are located in urban areas. So when I was studying for my STEP 1, I was doing that 1 year mandatory training because I still didn't know if I was going to come back home after my residency training. I think it was a big challenge to study for the steps. First, because most of my medical training to that day happened in Spanish. So it was, your brain needed to completely switch to a different language. And that was in part challenging. And you needed to start thinking in a different language. I think when you're conversational and a language is easy, you're using common words. But when you had to transform that to medicine, I think there's so many new words and so many things that you have to learn and you have to understand. And I think training is also different. Training in the Dominican Republic, there's a lot of attention put to tropical diseases like dengue fever, malaria, because they're very prevalent. But when you're studying for your STEP 1 and your STEP 2 CK, those diseases are maybe one question. So, it shifts more to autoimmune diseases, which are more common in the United States than they may be common in the Dominican Republic or Venezuela. So it is a different focus. So after I took my STEP 1, I moved to the United States, and then is when I started doing some more rotations in hospitals to get acquainted to the healthcare system. And I have to say that not all experiences were good. I had experience with a geriatrician that was quite negative. There were certain prejudgments about international medical grads that the person had when I was doing the rotation with that person. So it took work to show that we are trained very well and that we pass our steps and we are will be good physicians. I think something very important that I would recommend when you're doing your rotations as a MS2, MS3, MS4, depends on what is the design of your medical school, because some medical schools do start rotations in your MS2 year, is that you provide your letter writers with information. So by the time you're asking for your letter of recommendation, it's important that you first have a very updated CV and that has a US format and is in English. So make sure you have your CV updated and also that you have a personal statement. So you need a personal statement for your residency application. So when you are asking that letter writer to write the letter, many of us waive the opportunity to read the letter. So you really have to trust that person. So it is important you provide them with information. And in some cases, that person may ask you for a draft. And I would encourage you not to be shy and to use superlative to describe yourself. you pass the steps, you study in a different language, you're already part a very small group. So don't be shy writing these draft or letters that they may request you, because that will help your chances of getting into residency, because the letters of recommendation are very important. During my time in Seattle, something that's very important for me is social justice and health inequalities. So I got easily involved with the community, the Latino Hispanic community in Seattle. So I started volunteering in a clinic called CMAR that's located in South Park in Seattle and other rural parts of the state. So that allowed me to then get to know more people, to do health fairs. I used to visit the Mexican consulate in Seattle and give presentations to the people that were waiting to get into the consulate. They were waiting for a passport renewal, they were waiting for a new ID. So I partnered with this community clinic to provide information in Spanish to those patients or participants that were there waiting for the paperwork. So that was very good. And it allowed me to then work with refugees from Burma, and all of that can be included in your residency application. But I do have to encourage you to do things that matter to you. Community work, community service it has to come from something that you appreciate, something that you like, because otherwise we just may perpetuate the inequalities if you come and go only because you want it in your CV. So I volunteer in this clinic. Then I developed a network of Latinx leaders in the city. And then there was more invitations, more opportunities, and then more projects. Subsequently, I joined the Fortaleza Latina study, which was a study that evaluated breast cancer screening in Latinas at the Fred Hutchinson. And that led me a door into a research team that allowed me to join publications teams, learn about methods, and then do this research fellowship. So I think if you have the opportunity to do research, this is also important. I didn't get much research experience during medical school. So I subsequently matched at Rutgers, New Jersey Medical School in New Jersey, where I was an internal medicine resident. I knew I wanted to do oncology very early on. So a lot of my research was focused on oncology and cancer health disparities. We studied gastric cancer in the Hispanic community in New Jersey, which they present with more advanced stage, and they present, they have limited resources. So I went to ASCO for the first time in 2014. It was the 50th anniversary of ASCO. I still remember walking into the hallways. But then slowly I developed more relationships, not only with other international grads, but with other members of the Oncology Society. I have a wonderful mentor that allowed me to get these ideas, get them out, and of course, write me a letter of recommendation for fellowship. I think the number one recommendation is to have a plan. Like you have to have set out goals of when do you want to take your steps, when do you want to apply for residency, and if you want to apply for fellowship, and what is the plan for that. The process can be expensive. So the tests are expensive, step 1 and step 2. CS was canceled in 2020, but it may resume after the pandemic is over. So it is important that you take into account that it is a financial aspect to that. And when you're interviewing for residency and fellowship, you need to fly to the residency programs, fly to the fellowships, and none of that is covered. It needs to be covered by you. As a resident, it may be easier because you're already earning something, but when you're applying for residency, you're not. And finally, I think the most important thing is just to be yourself when you're going to interviews, when you're doing your rotations. Attendants and other faculty can notice when you are not being yourself and when you may agree to everything they say because you really want a good letter of recommendation. I think being true to yourself and do what you love, because if you do what you love, you will excel on that. But if you're doing things and you say yes to things that you may not be interested, it may be harder to get things done if we take your time away from things that you love. So in summary, to come to the United States to do your residency, it is a long journey. For some of us, we train in a different language. So translating was a challenge, switching your brain to English. It also takes time and it takes dedication. to study for your steps, but it is possible, it is doable. For fellowship, I matched at the Mayo Clinic. Initially, when I started the journey, I thought that wasn't even a possibility for me to do fellowship at the Mayo Clinic. And now I'm faculty at the University of Wisconsin. I have a lab. My lab is a lab in social justice, gender equity, and discrimination. We have close to 17 members in the lab. Some of them are permanent, so some of them are temporary. But all of that is possible. So as soon as you have your goals, and as soon as you are true to yourself and what you like, more than what people tell you like, I think is important. And I would be happy to answer any questions after you finish watching this video, and also during the Q&A question. It is possible. Oncology care is one of the best decisions I ever made in my life. Some of the best patients are patients with cancer. It is truly an honor to be there during their journey. And it is a privilege also to be part of this large community that tries to improve the outcomes of our patients with cancer and ultimately make it a chronic disease or cure the disease in some cases. So my name is Dr. Narjust Duma. I'm an assistant professor at the University of Wisconsin, and I'm originally from Venezuela. Thank you.